So I completed the Get Started in Health and Social Care program with the King's Trust. It sparked my interest because I was facing constant rejection when applying for jobs. I decided that I needed to find an alternative route in order to fulfill my dreams.
One of the greatest achievements of our health and social care project is that nearly 19,000 young people have participated in our programmes, and 94% of those have completed.
The programme's been in place for about 6 years now. The whole aim of the programme is supporting disadvantaged young people to consider careers in health and care. It's delivered in partnership with NHS England, NHS organisations and social care providers working with the King's Trust to provide placement opportunities, job opportunities, with the King's Trust providing that wraparound support.
Our health and social care programmes support the young people who need us the most. 51% of participants are from the most deprived postcodes.
There was a new contract with the King's Trust that was funded by the Department of Health and Social Care. It was looking at how we could support young people through the programme into the NHS. They've been able to work with individual employers and tailor that offer to those employers. So really in terms of job roles, so looking at certain trusts that maybe have high healthcare support worker vacancies, or trusts that may have roles in estates and facilities, or roles in administration.
Over 7,000 young people have been offered a role in the health and social care sector as a result of our programmes.
One thing that's really important is recognising lots of young people have lots of interest in the health and social care sector, but might not know exactly where their place is. So one of the most important things for us is to help them find what that role might be.
So as part of the support that we offer, young people can have access to a mentor if that's something that they think would help them. And some programmes also offer work experience opportunities too.
60% of participants are Black, Asian or from a global majority background.
So at Guys and St Thomas's, we've been working with the King's Trust for about 3 years now. And we have a secondee who is employed by the King's Trust, so they're a youth development worker, but they are part of our team effectively. And so they do a lot of the recruiting of young people to programs. They offer a lot of bespoke programs depending on where that individual is in their journey and what their needs are. And then we are able to interview them to offer them positions on our staff bank or permanent positions.
Our programmes return £5.62 of public value for every £1 of public sector investment.
I think there are 3 reasons why I would suggest it's important to attract a diverse pool of young people into health and care careers. First of all, it is such a rewarding job to do. You could talk to anybody, myself included, who works in health and care, and it is just wonderful. The second is that we have a responsibility collectively to be part of a community that looks after each other. And then the third is really from an NHS manager perspective, we're constantly having to think about our workforce and making sure that we've got the right people with the right skills, in the right place, doing the right thing at the right time.
We support partners by offering flexibility. We can attend events and design programmes to complement their own processes.
Knowing that I had people who truly cared to see me succeed helped me go into my first NHS job without feeling overwhelmed and anxious, because I knew that I had a network of people I could rely on.